This semester, we started off by doing some initial research around a potential problem in practice where we work. Over the past 2 weeks, we've talked about what a problem in practice is and some ways to gather that information, and you've likely at this point gathered some information through an interview with a supervisor. We've also begun working on identifying our independent dependent variables and our populations from that problem in practice and working those into a research question that's going to drive all of our work this semester. So, session 3 this week really starts to get into why that research question being clear is so important for your entire study and how it really starts to drive and to dictate what you do in your study in a way that makes things much easier. So, in sessions 1 and 2, we learn that when something is a good measure, that means that it provides us with valid and reliable evidence for specific phenomena, which in our work this semester is a specific area of evidence-based practice that we pulled out of our problem in practice. And it does this by having a clear independent variable, clear dependent variable, and clear populations for who's doing it, but also who's the target population for that dependent variable. The questions on our evaluation tool also need to be good measures, not just our research question, because when our questions on our program evaluation tool that we'll be creating in a few weeks are not good measures, then we end up measuring phenomenon other than what we intended. So this would lead us to having a body of evidence from our action research study that isn't about the practices, programs, and services, particularly how often, who's doing what, when, and how effective they are, right? So we won't have any of that information about the actual practices, programs, and services that we're trying to evaluate. When all of our questions on the evaluation tool are good measures, they collectively provide a body of evidence without any gaps or holes. And our research question is going to help us make sure when we go into the literature this week in our literature analysis that we aren't missing anything, that we don't have any gaps or holes. So we can kind of think of this as a flow chart here. We start with our problem in practice, and from that we identified our research question with our independent variable, dependent variable, and population. And when we have that population, really the next step once we have a population in the next coming weeks is that's who we're going to collect sample data from in terms of who's doing what, right? But we also have our dependent variable, so this is our outcome. And we have our independent variable, which is a specific area of practice that we're focused on improving this semester. So what we're going to do in a literature analysis, and really what the purpose of the literature analysis is to analyze the literature on evidence-based practices related to that specific area of practice. And as we analyze the literature on those evidence-based practices related to the independent variable, whenever possible, we want to look for practices in relation to the target population and the target outcome. So if we do all of those things, if we look at our independent variable and we look in the literature for evidence-based practices related to it, and we pay close attention to evidence-based practices that are not only related to our independent variable, but reference our population. So looking for practices that are done by the stakeholders or in the context and settings that we are looking to improve, right, for our problem and practice this semester, if possible. It's not always possible, but we want to make sure if we can, we try to emphasize our population and our outcome, not just our independent variable. But what we're doing is by looking for those evidence-based practices within the literature that relate to your independent variable, we're going to break them out into domains and find all the sub-practices. And really what we're doing here is building out a profile of the independent variable. We're going to operationalize the independent variable. So all of the characteristics that go into that specific area of practice, we're going to identify those practices, those sub-practices within the literature. So it's helpful to think of this in their own little subdomains for sub-practices. So we can think of, if we have an independent variable and we break that down and look in the literature for practices related to it, we can think of practices related to assessment for our independent variable, instruction, content and curriculum, and collaboration. We may also think of additional domains of sub-practices that we'll be investigating within the literature to build out that operationalization or that profile of our independent variable. So this results in independent variables with all the sub-practices identified for how it's going to be measured, right? So we can't just say that we want to measure person-centered planning. There is so much that goes into person-centered planning as an example, right? So we might have age-appropriate transition assessment as our domain, but sub-practices may be questionnaires completed by students and self-reflections. It may be checklists and observations by a teacher, by a job coach, by an employer, by a counselor, or family. We would have instruction, right? So we might be providing instruction to students to help them be prepared for their IEP. So they might learn about the IEP process. They might learn terminology. So that could be our content. And how we deliver that for our instruction, we might be doing direct instruction. We may have different activities. We may be modeling what it looks like to lead or present during an IEP, or we maybe start off by modeling the IEP itself. And collaboration may be involved. So in this example, different collaborative practices to make sure that the transition team is all on board and communicating and supporting in a coordinated way a young person in being a leader in their planning process and their transition planning process. So that's just one example of how we might use those 4 domains to start building out a profile of sub-practices for an independent variable. And what happens is once we have all of these sub-practices identified, what this ends up being is all of the mini sub-independent variables that are going to be measured by each individual question on our program evaluation tool. So this week, when we're doing our literature analysis, the outcome of this, when you're building a program evaluation tool, is often called item writing. We call questions on a program evaluation tool items. And what you're doing is by identifying all of these sub-practices, you're identifying all of the independent variables that are going to be measured in the questions on your program evaluation tool. So this whole structure that you just learned for your research question is the same thing when it comes to a program evaluation tool. They're worded a little different, but in terms of always having an independent variable, that's always going to be the case because you always need to measure something specific in your, not only your research question, but each individual question of your program evaluation tool. So this week is gathering all the content that you'll need, all the sub-practices that you're going to measure on your program evaluation tool, which we'll start building next week. So this is all the content that will go into next week. You can see how your research question is directly informing now how you're going to be making your tool. So just to kind of wrap that up again one more time and to see that bigger picture of where we're going. So this week we are analyzing the literature. We're digging into literature on evidence-based practices to identify sub-practices that align with our independent variable in our research question. And this will tell us the characteristics of each sub-practice that are going to be measured. So later on in a week or two, we'll take all of these sub-practices and we'll turn them into questions. And we'll be measuring all these sub-practices in terms of what happens and how often, how effective it is when it's implemented, how knowledgeable and skilled stakeholders are to implement that, and what factors might be influencing its implementation. In order to conduct your literature analysis and to end up with this profile of sub-practices that will end up becoming the content of your program evaluation tool, what you'll measure, all of the sub-practices that you'll measure, you'll start off by looking at your research question, reviewing your dependent variable, your independent variable, and the populations. So the population for the dependent variable, the outcome, right? So maybe a student or family or stakeholder outcome, and population in terms of the independent variable, so who's actually doing these practices that you're trying to improve. So once you review your independent, dependent variable and your populations, you're going to start looking into the literature on evidence-based practices, and your goal is to identify overarching areas of practice, which just like we showed, so instruction and curriculum assessment, collaboration, or others that you may find for the independent variable. And then once you have those, you'll identify sub-practices within each of those areas of practice that are aligned with that independent variable. And then as much as possible, which is not always possible, your dependent variable and your population. You'll find with the literature on evidence-based practices that apart from specific evidence-based practices for students with autism or students with specific disabilities or significant disabilities, generally the literature on evidence-based practices is broad. It's generalized to largely the large population of different disabilities that young people may have. So you may come across literature that is specific to your population, and you'll certainly want to look for that. But if you're not finding that, that's okay. Your main purpose for this is to identify sub-practices within those big sub-areas. So instruction, assessment, curriculum, collaboration. So you're going to be looking for sub-practices that are all aligned to your independent variable. And just as an example of the literature analysis process, so let's say that my independent variable is soft skills instructional methods, and I'm trying to improve them at my site. I would review literature on evidence-based practices aligned with the independent variable. So I might look at Rowe's Adelphi study on evidence-based predictors. I may look at some curriculum like Skills to Pay the Bills that OSEP put out, so I know that it's a valid tool. And I would definitely look at the NTACT database for evidence-based and research-based practices. That would definitely be a primary spot that I'm going to be looking, and I highly recommend that you look there too as you're trying to find literature to support and to help you build out what those sub-practices within your independent variable are. So let's say those are the three resources I'm pulling from, and then I would operationalize my independent variable based upon all the sub-practices that I find. So I have soft skills instructional methods, and within that I identified role-playing and simulation for workplace manners, video and direct modeling to support others at work, an executive functioning checklist, which could be completed by a teacher, or a self-checklist for a student, or a family checklist for the young person. So that is exactly the process that you'll be taking as you look into the literature to build out your independent variable into this profile of sub-practices. And you can see here in the three that I've pulled, so we have some instructional methods and checklists or an assessment approach. So those would fit in those boxes, in those domains that I was just mentioning previously. Moving away from our work specific to this week in a literature analysis, once we have our literature analysis complete, in the following weeks we're going to be creating a data collection tool like we've been talking about now that is both qualitative and quantitative. So the question is, what is a qualitative and quantitative tool, right? So when you're doing action research, there are a couple different designs that you can use to design your study. And when I say design, I mean the ways in which you'll collect data and the ways in which you'll analyze that data. So for action research with a methodology, action research is a methodology, we have different designs that we can use, which means different ways of collecting and analyzing data to help us understand our problem in practice. For us this semester, we're going to be using mixed methods. So we're going to be using both quantitative and qualitative design or methods to understand our problem in practice. So that's the lived experience, which is the qualitative, and the quantitative, which is that numerical data to explain a phenomenon. So for our quantitative methods, The strengths are that they are precise measures, often, if they're made well, of characteristics such as duration and frequency. Often results can be generalized, and it can reduce bias when the tool is properly made. And analysis is largely procedural, so it's not up to interpretation. You use specific methods to understand your numerical data. Some weaknesses are that it measures for perceptions such as effectiveness, but it often lacks contextual details to really understand what effectiveness is. So you might have ratings of effectiveness, but you lack the contextual details that you might need to take that and to make a practice actually more effective. So it's helpful. It gives you a barometer about what's going on, about how effective something is, but you need more contextual information often to do something about it. And this is really where qualitative methods in design in terms of data collection and analysis come in. So the strengths are that we are able to gather that contextual information about characteristics such as duration and frequency of practices, but also in-depth information about what's contributing to how practices are being done and how effective they are, and how those practices are actually implemented. So specifics about how these practices, not just how often they're happening and how effective they are in terms of ratings, but how are they actually being done across contexts where this problem in practice exists. There are weaknesses, though, that our quantitative data can support when it comes to qualitative data. So for qualitative, it's hard to generalize your findings because you're getting the perceptions and experiences and accounts of each individual. So it's really hard to generalize across those individuals versus your quantitative information where it's always measuring the same thing, and your numerical data, given that your sample is representative of your site, is generalizable to likely all of the stakeholders working there if you have results by all different stakeholder types who are involved in the problem and practice. So you are able to generalize with quantitative if you have a proper sample, but with qualitative, even if you have that proper sample, it's really difficult to generalize those findings because you're then trying to generalize the individual narrative lived experiences across people, which is possible, but that analysis is subjective. So it can increase bias in your results. The thing to remember is that even with that subjectivity and bias, that there is so much power in your qualitative data, in how it can build out in-depth contextual information about how often and how effective and how prepared and knowledgeable and skilled practitioners are perhaps to implement these practices when they do happen. So you can see how it's not that one by any means is better than the other, or that you should be a qualitative or quantitative researcher. That's not the case. What you should be using and doing is both. So you should be pulling from both, because you can see in this example here that qualitative and quantitative each have a weakness that the other one supports. So they fill all the gaps that each other have. And that's why we use mixed methods and why we're using mixed methods this semester. So when you're creating your program evaluation tool, you'll be creating questions on that tool that both measure quantitatively and qualitatively. So you'll be getting numerical information, but also narrative written responses from your stakeholders at your site about their lived experiences around doing these particular practices. So when we do this, when we collect both qualitative and quantitative, we need to have a process or a sequence in which we do that. So this semester you're going to be using convergent design, and what that means is that we're going to mix both. We're going to converge them together. We're going to simultaneously collect quantitative and qualitative data on our program evaluation tool, and then we're going to compare, contrast, and combine between our numerical data and our qualitative data to build out our main findings about what's going on with that problem in practice, right? So if we're finding out information about a practice is rated not effective at all, then we're going to use our qualitative information in a few weeks to say, okay, if it's not effective, then why? What does not effective look like when that happens? Who's doing it? What are the outcomes of that? So that's what compare, contrasting, and combining to a more specific explanation will look like in a few weeks. We're not doing that this week, we're not doing that yet, but in a few weeks we will be, and it's nice to see how our study is aligning as we start moving from our theory in the past 2 weeks to direct application now this week and moving forward. While we won't be using it this semester, for anyone who wants to continue to use action research in their own work, there are additional types of designs that you can use in terms of whether or not you collect just quantitative, qualitative, both. And in this case, I have an additional design that is frequently used in action research where you're collecting both quantitative and qualitative. Now, we know that it's not always possible to collect quantitative and qualitative data, but whenever possible, it's what we should be doing, because we know from our previous example here that when you use quantitative and qualitative data together, you get to fill out all of the gaps, weaknesses, and holes that each approach has on its own. So while we're using convergent, so we're going to be collecting this information at the same time and comparing and contrasting to find our themes later on in the semester, there's also something called explanatory design. And that's when you, instead of collecting your quantitative and qualitative at the same time, you collect quantitative measures first. So you might just collect information about how often practices are happening or how prepared people are to do them. And then you might say, wow, okay, I have a few participants, I have a group of my participants at my site, stakeholders at my site who responded that this is really ineffective or that they feel really unprepared. And then rather than collecting a bunch of qualitative information from everyone, you might just collect information from only those people. So this is when you start using your results to dictate your sampling methods. So using your quantitative results here to tell you who you should go more in depth with. And that's what explanatory design is all about, where you're using your quant to explore, to do that initial exploration and to give you a heads up on who you need to go deep with, where you're going to use qual to explore the context and experiences with these people behind specific trends in your data. So that's when you take a really deep dive and look really deeply with your qualitative, whether it could be written responses on a survey or it might be interviews. These are things we're not doing this semester, but I just want you to be aware of this other approach that you can use if you choose to use action research in the future in your own work beyond this semester. So this can be really useful if you just want to find out specifically who needs the most help when you're doing action research. So you give a quick survey maybe to your site and you say, okay, all the people who responded really low, that they're not doing this, they're not prepared, they feel like that this is not effective, and you just focus in on them, and you might use a survey, you might use interviews. There are a bunch of different methods that are beyond this course, but it's important to know that this is an option as well.